Hi, following up on our video from last week, this is the second week of October, and October is Audiology Awareness Month. So as the audiologists from Associated Hearing Professionals, we thought we'd put out short videos each week to talk about what we do. What we'd like to address this week would be comorbidities associated with hearing loss. So I'm Tina, this is Margaret, this is Lauren, and we are the audiologists here at Associated Hearing Professionals. Hearing loss is associated with other health conditions, and we try to look at things as a medical model and holistically look at the patient's entire well-being. So one of you want to address some of the comorbidities that we...
Well, one of the biggest is depression. People with hearing loss often feel isolated and left out and may misinterpret conversations, and so the depression and isolation, I think, can lead to even other health issues. So that's the biggest one that I can think of.
We also know that untreated hearing loss can have cognitive effects as well. We know that it can mimic like memory impairment. We know it can look like dementia or Alzheimer's. They may, like Tina mentioned, they may be comorbid existing together, but sometimes having untreated hearing loss can exacerbate the memory issue that is already there. And so it's really important to be aware of those things and try to decipher between the two. If it is hearing loss that is causing some of these symptoms, we can work with that. And so, a big thing is that we need to treat the hearing loss. We need to put a hearing aid on there. We need to stimulate the auditory part of our brain to keep, other parts of the brain working as they should be. It's not gonna cure, the memory issue that is already there, but certainly it can help.
Last week I helped a patient, I fit hearing aids on her. She had dementia, or I should say has dementia, and her daughter was very concerned. She was becoming withdrawn. It was just very, sad for the whole family. She has a diagnosis of Alzheimer's. We put the hearing aids on her, and her daughter called and said, Mom is so much more engaged. Like she was following conversations. And yes, she still does have memory issues. She still does have dementia, but at least we took that part out of the equation. Yeah. And with dementia, the patient might not have dementia. Sometimes patients, even young patients with hearing loss that goes untreated, they'll be in a social situation, and I think we've all seen this, and they'll be at a restaurant and they won't be able to hear, and so they'll just sit there like a bump on the log.
Or respond completely inappropriately.
Respond inappropriately.
Yeah.
So people think maybe they do have dementia, or if they don't respond at all, they might think they're aloof. Or they might laugh because everybody's laughing, but not really hear the punchline of the joke.
Right.
So dementia's a big thing too, and the depression. But then there are other things too, like cardiovascular disease, diabetes. They all have like some kind of correlation, I guess is the word, with hearing loss. And we don't know if it's because of, the blood circulation issues or what, but it's important to rule out other medical issues. So that's why we often refer to doctors.
Yes.
For that, or the doctors will refer to us. They have a patient who's diabetic and we need to make sure what is their hearing loss. Let's get a baseline test so we know what's going on.
Absolutely.
Something that you wouldn't think of is with untreated hearing loss, there's a 3 times greater fall risk.
Right.
And with older adults, when they fall and break a hip or hit their head, sometimes they don't fully recover cognitively and physically. So some of the hearing aids actually will send a fall alert to family members.
That's true. That's really good.
Yeah.
So that's real important for older adults, especially if they live alone, to have the fall alert. Yeah.
I think it's really surprising to learn that the ear can be such an eye into the rest of the, the whole body health. Surprising, but
well, it's true. The knee bone's connected to the whatever bone, and it all, everything's connected. Everything's
I like
connected.
how you mentioned your patient who had dementia
Mm-hmm,
and how the daughter called you all excited
mm-hmm,
for her mom. She was excited that her mom could engage. And
Right.
so I think that just brings it back full circle, right? You think the hearing loss only affects that individual who has hearing loss,
mm-hmm,
but it doesn't. When you get deeper into it, it affects the whole family.
Yes.
And so, untreated hearing loss, again, think about family functions and stuff like that. Not only does that person who's affected with hearing loss maybe dread the function a little bit, but the family members think, well, that person's not going to want to engage with us.
mm-hmm.
They're not going to be part of the conversation. They probably feel bad for that person who has hearing loss too.
Mhm.
So then when we put hearing aids on them and they're able to converse again.
Well, and that's the best thing about audiology. We get to help the whole family.
We
Yep.
do. But that made me think what you said, Lauren, about, the family and everything. It's kind of a segue, not about comorbidities, but during the lockdown of COVID, people became more aware because they were in the house with their family members, and I think they became more aware, okay, he really does, or she really does need help.
Yeah.
Because the TV was so loud, or the Zoom call was so loud, or there were several people in the house at once, and maybe the kids were home all day, and it was just, people became aware. So I think as soon as the lockdown broke, people were out in, just numbers trying to get help for their hearing loss, which was a good thing for us. But with the masks, they couldn't read lips, so it all kind of goes together.
It does.
It does.
Mm-hmm.
So I would just say, if anybody wants more information, then we would recommend you call us, 636-778-9232, or look at our website, www.hearstl.com.